This appears to be the weekend that we're going to have the climactic debate and possibly vote on the so-called health care reform package that Speaker Pelosi, President Obama, and Majority Leader Reid has put together. The first thing you need to understand that the process they're using is highly unorthodox and at least potentially unconstitutional. There will be a vote apparently on a self-executing rule in the House that will deem the Senate bill passed automatically if the rule passes. I can't recall that ever being done in the time that I've been in the House on a major piece of legislation. That's what the debate's going to be about in the House this weekend. If that rule does pass, and I think it's a debatable proposition whether it will, but if it does pass, then the Senate would have to pass a package of changes to the bill that the House just voted to deem to have passed that have, as of yet, have not been made public, that have been negotiated behind the scenes with the Democrat leadership in the House and the Senate. Both of those bills would go to the President, who would first sign the deemed passed bill that the House voted on, and then the Senate passed reconciliation package. Now, the problem with that process is that it's not automatic, and in the Senate, Republican senators can offer amendments and get votes, and to close off debate, you have to have 60 votes to close off debate in the Senate. So, if by some political sleight of hand the Democrats are able to get this self-executing rule passed in the House this Sunday afternoon or Sunday evening, it's going to be a long drawn-out process to get the then pre-agreed upon reconciliation changes made in the Senate. On the merits of the case, the American people have looked at the various bills and the various leaked changes and have come to the conclusion by approximately a 2-to-1 margin that they prefer the current system to this new system. The American people is more intelligent and smarter than Speaker Pelosi or Majority Leader Reid or President Obama. We have a health care system that's the best in the world. 85% of the American people have insurance coverage. If this bill were to become law, you would have much more government intervention, either directly or indirectly through mandates and government bureaucracies such as the Health Choices Administration and the Comparative Research Council and things of this sort. By their own admission, the CBO score that's just come out says these costs are going to cost about $940 billion over 10 years. That's probably an underestimate, in my opinion, based on what I know about the coverage mandates in the bill. The President and the Democrats who support the package claim that it's going to save money, but it kind of insults the intelligence of the American people. If you cover all these additional people, you mandate all these additional coverage options, it would stand to reason that that's going to cost a lot more on a net basis. The reason they can claim that it's going to cost less is because they cut Medicare, they raise payroll taxes, they have a tax on individuals, they have a tax on employees, they tax certain sectors of the healthcare industry, like some of the pharmaceuticals, some of the durable medical equipment. So they don't reduce spending, they don't save a lot of money, but because they're apparently, in terms of a technical sense, raising more taxes than the cost of the coverage, they do claim that it saves some money. I'm here to tell you, in the plainest possible language, in the real world that won't happen. This is a bad bill. It should not be passed on the merits, and it should certainly not be passed by some cynical, political, sleight of hand procedural motion that is an insult to everybody who thinks Congress ought to operate in an open, transparent fashion with up or down votes on the substance of the issue. I will vote no. I will lead the opposition against it. I will be organizing my committee Republicans and generally House Republicans to come and speak against it on the floor and use every available opportunity to rally you, the American people, to oppose this short-sighted, misguided piece of legislation.